My name is Dr. Mazansky, and my website is drmedicalhypnosis.com. I specialize in medical hypnotherapy, guided imagery, nutrition, and exercise. Today's health tip, we are going to talk about warning signs of type 2 diabetes. Because the incidence of type 2 diabetes is increasing in the US and in the Western world, I thought I would talk about it. The main reason for developing type 2 diabetes is overweight. Although sometimes you can lose weight, but being overweight is one of the main causes that precipitate subsequent diabetes. Also, your age group being over 45, your race, African Americans and Asians and Native Americans have a particularly high incidence of type 2 diabetes. Type 2 diabetes differs from type 1 in as much as type 1 diabetes, it is inherited early on in life, maybe at 10, 12, 14 years of age, and the treatment is insulin. Type 2 diabetes develops later on in life, and we'll discuss the management later. Now, some of the warning signs of diabetes are initially there are no signs. Later on, patients develop a dry mouth or frequent urination. They get recurrent infections that don't heal, yeast infections, and illnesses that occur, such as upper respiratory infections, do not run the normal course but take much longer to improve. How do we test for diabetes? The main test is a blood test where the blood sugar is tested immediately to get a blood sugar value, but it can also be tested over 3 months, and that's called the A1C, to see what your blood sugar is over 3 months, the normal value being up to 6. How do we manage the diabetes? Mainly it is through weight reduction. If most people are overweight, weight reduction, stress management, stress can also be a precipitating factor for diabetes. Stress management, exercise, 20 minutes, 5-6 days a week, walking is all you need, and a low fat and certainly a low carbohydrate diet, because it is the carbohydrates, the white flour, the white bread, the white pasta, potatoes, etc., that convert to blood sugar raises and aggravates the diabetes. Complications of diabetes can be many, in that it can affect the eyes and blindness occurs. It can affect the kidneys with renal failure, can affect the nervous system with what is called neuropathy, where you can get a burning sensation in your feet. It affects your sexual performance. Males get ED because the small arteries become blocked with cholesterol and damage is done by the high sugar. Females get vaginal dryness and do not reach orgasm properly. There are many treatments available. Type 2 diabetes is first treated with a strict diet and exercise program. If that doesn't bring down the blood sugar, then there are oral hypoglycemic agents, oral medication that one can use to bring down the blood sugar. If that doesn't work, then usually insulin is added. In type 2 diabetes, you have an insensitivity to the insulin. In other words, it's called insulin resistance. Sufficient insulin is secreted, but the cells are not, the cells do not respond to the amount of glucose that is there. Another type of diabetes, when is when there is an actual shortage of insulin. And in those cases, medication is given to stimulate the pancreas gland to form more insulin and thus treat the diabetes. Much more can be stated, but I do not want to draw out the length of the video. That is in the crux of the matter, and prevention is better than cure. We treat the diabetes with weight loss, and if the weight loss doesn't work, on the website drmedicalhypnosis.com is a weight loss video. For stress management, if you cannot handle your stress, there's a similar video available for you. But diabetes can be a lethal disease. Together with the diabetes usually goes high cholesterol and high blood pressure. And the HDL, or the good cholesterol, is lowered, and the LDL, or bad cholesterol, is raised. So it's something not to take lightly. Treatment is available, and get tested when you see your physician next time. Thank you. My name is Dr. Hillel Mazansky, and thank you for listening to this video.